Hello and welcome. Today we're diving into nonverbal learning disorder, or NVLD, a neurological condition that can significantly impact a person's ability to process nonverbal information. While it's often overshadowed by other learning disabilities, understanding NVLD is crucial for providing effective support and intervention. The exact causes of NVLD remain a subject of ongoing research. There isn't a single, definitive answer, but rather a collection of factors that likely contribute. Genetic predisposition seems to play a role, as NVLD often runs in families. Neurological differences in brain structure and function, particularly in the right hemisphere and the white matter tracts connecting different brain regions, are also suspected. These areas are crucial for processing visual-spatial information, social cues, and adapting to novel situations. Early brain development and experiences may also influence the emergence of NVLD. The pathophysiology of NVLD centers on how the brain processes information. Individuals with NVLD often have difficulty integrating information from different sensory modalities, especially visual and spatial cues. This can lead to challenges in understanding nonverbal communication, such as facial expressions and body language. The right hemisphere of the brain, which is typically responsible for spatial reasoning, visual perception, and holistic processing, may function differently in individuals with NVLD. There may be issues with the connectivity between brain regions, hindering the efficient transfer of information. This disrupts the ability to form a cohesive and meaningful understanding of the world around them. Determining the precise prevalence of NVLD is challenging due to varying diagnostic criteria and a lack of universal recognition. Some researchers estimate that it affects roughly 1% of the population, while others suggest higher or lower numbers. It's important to note that NVLD is not currently recognized as a distinct disorder in the DSM-5 or ICD-11, which can lead to underdiagnosis or misdiagnosis. NVL appears to affect males and females at roughly equal rates. It's also important to consider that NVLD often occurs with other conditions such as ADHD, anxiety disorders, and autism spectrum disorder, further complicating prevalence estimates. The signs and symptoms of NVLD can manifest in various ways, often becoming apparent in childhood. Individuals with NVLD typically excel in verbal skills, such as vocabulary and rote memorization. However, they struggle with visual-spatial tasks, such as reading maps, understanding diagrams, and organizing their belongings. They may have difficulty interpreting nonverbal social cues like facial expressions, body language, and tone of voice, leading to social misunderstandings. Motor coordination can be impaired, resulting in clumsiness or difficulty with fine motor skills like writing or buttoning clothes. Problem-solving skills, especially in novel or unstructured situations, can be a significant challenge. Difficulties with generalizing learned information to new contexts is also a hallmark of NVLD. Diagnosing NVLD is a multifaceted process that requires a comprehensive evaluation by a team of professionals, including psychologists, educational specialists, and possibly neurologists. There isn't a single test that can definitively diagnose NVLD, so clinicians rely on a combination of assessments. These assessments typically include cognitive testing to evaluate verbal and nonverbal abilities, academic testing to assess reading, writing, and math skills, and behavioral observations to evaluate social skills and adaptive functioning. Neuropsychological testing can further assess specific cognitive functions, such as visual-spatial processing, executive functioning, and motor coordination. Gathering information from parents, teachers, and the individual themselves is crucial for gaining a complete picture of their strengths and weaknesses. A differential diagnosis is also important to rule out other conditions that may present with similar symptoms. While a formal classification of subtypes within NVL doesn't exist, clinicians often observe variations in the presentation of symptoms. Some individuals may primarily struggle with visual-spatial processing, while others may have more pronounced difficulties with social skills or motor coordination. Recognizing these variations can help tailor interventions to address specific needs. Currently, there is no cure for NVLD, but a variety of interventions can significantly improve an individual's quality of life. Educational interventions focus on building compensatory strategies to address specific learning challenges. This may involve providing visual aids, breaking down tasks into smaller steps, and offering extra time for assignments. Social skills training can help individuals learn to interpret nonverbal cues and navigate social situations more effectively. Occupational therapy can address motor coordination difficulties and improve fine motor skills. Cognitive behavioral therapy, CBT, can help manage anxiety and improve problem-solving skills. Parent training and support groups can provide families with the tools and resources they need to support their child's development. Because the causes of NVLD are not fully understood, there are no specific preventative measures. However, early identification and intervention are key to mitigating the impact of NVLD. Creating a supportive and understanding environment at home and school can help individuals with NVLD develop their strengths and build confidence. Promoting early language development and providing opportunities for social interaction can also be beneficial. The prognosis for individuals with NVLD varies depending on the severity of their symptoms and the effectiveness of interventions. With appropriate support and accommodations, many individuals with NVLD can achieve academic success, build meaningful relationships, and lead fulfilling lives. However, some individuals may continue to face challenges in social situations, employment, and independent living. Ongoing research is focused on better understanding the underlying neurological mechanisms of NVLD and developing more targeted interventions. Recent studies are exploring the use of neuroimaging techniques to identify specific brain differences in individuals with NVLD. Other research is focused on developing more effective interventions for improving social skills and executive functioning. Ultimately, increased awareness and research efforts will lead to better outcomes for individuals with NVLD